mission. Actually, he's in South Africa. You may recall that last week he was in Rwanda. So our meeting today is going to be a little bit shorter because he has other appointments coming up. And so we will take 50 minutes for this briefing today. For your question and answer session, as usual, please utilize that number +251 94 550 2310. Let me give that to you again, +251 94 550 2310. And of course, as usual, you can come through live as well as send your questions in to the question and answer section. All right, let me now hand over to Dr. John, who is actually coming to us from Cape Town in South Africa for that briefing. Dr. John, I hope you're not too cold in Cape Town and you have the floor.
Thank you, Wynne. It is cold in Cape Town, but just nice weather for a change. Greetings from Cape Town to all of you on this platform this morning, and thank you for always joining this forum every Thursday noon. As usual, I'll do three things: give you an update on the epidemiological situation across the continent, and then discuss our support for the countries, member states, and then conclude with an update on vaccination. As Wynne said, I've been doing a tour of countries, member states, to really see firsthand what is going on in the field with respect to vaccines and vaccination across our continent, so that we continue to learn from the lessons on the ground and then better organize ourselves to support member states based on the reality. So let's start with the epidemiological situation. As of today, May 27, the continent has reported about 4.7 million cases of COVID-19. That represents about 2.8% of the overall total reported globally. The death rate stands at 129,000 cases, and that represents about 3.7% of the overall deaths. Our case fatality ratio, which is the number of people who have died out of the number of people that have been reported to be COVID infected, stands at 2.7%. The following 5 countries are reporting about 63% of the total number of cases. They include South Africa, 34%, Morocco, 11%, Tunisia, 7%, Ethiopia, 6%, and Egypt, 5%. As I indicated earlier, the global case fatality ratio rate is 2.1%. If we now look at the variant situation, which we've discussed severally on this forum, 27 countries are reporting the B117 variant, originally identified in the United Kingdom. One additional country has been added to the list, that is Burkina Faso. For the 7% of our member states, that is 26 countries, are reporting the B1351 variant, originally reported in or identified in South Africa. And one additional member state, Tunisia, has been added to this list. So clearly the variants continue to circulate or be identified in many other countries. 18% of our member states, or 10 countries, are now reporting the B1617 variant, originally reported or identified in India. One additional member state, that is the DRC, has joined the list. If you look at the trends now, as we do every week, we look at the 1 weekly trend and then look at the 4 week trend. Between the week of 17 to 23rd of May, we've recorded 69,394 new cases, and this represents a 24% increase from previous week. I'll come back to that shortly to explain this increase because of some regional trends. The highest proportion of new cases is from Southern Africa region with 41%. Again, that explains that sharp increase. Northern Africa, 34%, East Africa, 14%, Central Africa, 7%, and Western Africa, 5%. The following 5 countries are reporting the highest number of new cases: South Africa with 21,000 cases, Tunisia with 8,000 new cases, Egypt 8,000, Cameroon 3,000, Kenya 3,000. In terms of new deaths, a total of 2,197 new deaths have been reported across the continent, compared to 1,848 from the previous week. This represents a 19% increase in new deaths from the previous week. Let's now turn our attention to the last 4 weeks and stretch that and see and compare events that have happened between April 26th and May 23rd. In terms of new cases, we've recorded an overall 0.4 average decrease in new cases. You can see that the sharp increase over the last week has now brought down a number of the trends that we are seeing over the last 4 weeks. So an average of 0.4 average decrease across the continent over the last 4 weeks. The following are the regional trends: 136% increase in the Central Africa region, 21% increase in Southern Africa, 4% decrease in North Africa, 11% decrease in West Africa, a 17% decrease in East Africa. In terms of deaths, there have been an overall 1% average increase in new deaths reported over the last 4 weeks. Let's transition to testing. As a continent, we've conducted over 47 million tests. And the good news is that over this week, I'm really happy to see that the continent conducted about 1 million new tests, and that represents an increase of 32%. If you recall, 2 weeks ago, I was making a strong appeal for the continent not to relent on testing. And I'm very encouraged, and I hope this trend will be maintained. The overall positivity rate, however, remains high, about 10.2%, with a test per case ratio of 9.8%. Let's now go to the situation with vaccines and vaccination. As of the 24th of May, 2021, a total of 43 million vaccine doses have been acquired by member states, with approximately 28 million doses being administered. The figure corresponds to a coverage rate of 1.62%, with a slide with about 0.46% of population fully vaccinated. To date, AU member states have used up about 65% of their vaccine supplies, and this represents a 0.8 increase compared to the last briefing. Some numbers, just to highlight some of the progress so far. Morocco has used up 12.7 million doses of vaccines, representing 99% of its supplies. 13% of the population has been fully vaccinated. Ethiopia has used up 1.6 million doses, representing about 67% of its supplies, with 1.5% of the population vaccinated. Kenya has used up 954,000 doses, representing 93% of its supply fully used, with about 1.8% of its population fully vaccinated. So the point of this is that insofar as we have challenges in some countries, I mean, a vast number of countries, including what I briefed you on in Rwanda the other week, are making very good progress with respect to use of their vaccines. In South Africa, where I am, tremendous progress has been made. The government has secured enough doses to inoculate the adult population. I was in a very extensive meeting with the Minister of Health 2 days ago, and their numbers are very impressive. If those vaccines can continue to come in and the uptake also complies, then they should be able to achieve their target of immunizing over the adult population, about 70% of their population. As of 25th of May, South Africa had administered about 700,000 COVID vaccines. South Africa has effectively administered around, if you transform that into per 100 population, about 0.9 doses per 100 people in population. This week, the US biotechnology firm Moderna said that in their recent trials, COVID-19 vaccines showed safety and efficacy in adult population age between 12 and 17 years. I think that let me end there, Wayne, and then turn it over to you. Thank you.
Thank you very much. That was our briefing coming from Dr. John Kengasong. And we move straight into your questions. The first one is coming from Paul Adepoju, and he's writing from Nature. So Paul says, Dr. John, do you consider that COVID-19 is the biggest ever test for the Africa CDC? That's one part of the question. Then he goes on, how do you think that the COVID-19 experience will impact and influence the center's works on other diseases, including HIV and AIDS?
So, Paul, thank you for that question. The short answer to that is yes. It is the biggest challenge we, as Africa CDC, have had in a very short history. If you recall, Africa CDC was launched in January 2017 at the sidelines of the Head of State Summit in Addis Ababa. And in that 4 years, we have been launched straight on into responding to disease outbreaks in several countries, actually in more than 15 countries in a very short history that is prior to COVID-19, but predominantly also in a very sustained manner in North Kivu, where we deployed over 65 responders to support the government of the Democratic Republic of Congo to fight Ebola in North Kivu. And then COVID hit, and it was a massive effort. It was not regional, it was spread all over the continent, and we had to stretch ourselves. But I must say that in this exercise, the political leadership of our continent, at that time last year, headed by President Cyril Ramaphosa, the President of South Africa, and the rotating chair of the African Union last year, and the remarkable leadership of the chairperson of the African Union, Chairperson Moussa Faki, were very determined in guiding Africa CDC and bringing it to the fore. So the challenge was there, but the political support and commitment was also very clearly in play. With respect to the impact that CDC will have going forward, I think there's no doubt that this is a transformative moment for the Africa CDC, where with the political support that it now has across the continent at the highest leadership, it is poised to play a very strong role to enable the continent to fight other endemic diseases, including HIV, TB, and malaria. And that effort will complement nicely the efforts of the World Health Organization, especially the regional offices in Africa. So I think in any crisis, we should always strive to look at, see where the bright side is, and the bright side of this crisis we are facing, which is a generational crisis, and with an unprecedented nature, and with an unpredictable ending, is that Africa CDC will be strengthened to continue to be that strong health security instrument for the continent.
All right, thank you. The next question is coming from Megan Lawrence, and she's welcoming you to Cape Town because that's where she is as well. So she says, why hasn't South Africa received any vaccines via COVAX? Is it because we are mainly receiving AstraZeneca and the country cannot use it? And then she goes on to say, could you maybe shed light on when the country will receive vaccines via COVAX?
So, Megan, feel free to join me live so that we can jointly do this press conference from your home city of Cape Town, a beautiful city. So, South Africa is in discussion, or was in discussion with COVAX. And, you know, South Africa will certainly acquire some vaccines through COVAX based on the arrangements that they had. If you know, the COVAX facility has two dimensions. There are countries that will pay for their vaccines, and those are called the medium income countries, where South Africa and I think Gabon and Botswana seem to be in that category. And other countries were receiving free vaccines because of the status of their own development. But South Africa has acquired more vaccines through their bilateral negotiations through Pfizer and others, Johnson & Johnson, and enough to cover a large chunk of its population. And if once those vaccines start getting in, there's no doubt that the pace at which the program is now, I just indicated about 700,000 people immunized, but based on the analysis and the discussions I had with the Minister of Health 2 days ago, this is clear indication that the program will pick up very, very quickly once those vaccines start arriving in South Africa. So just to add that South Africa is not predominantly using AstraZeneca. They stopped the first 1 million doses of vaccines that arrived were not used. They were acquired by AVAC and then shipped to other countries because of the variant that we have discussed on this platform.
All right, thank you for that clarification. So Maggie Fick, who is with Reuters, says, what is the priority? Is it wealthy countries donating their excess vaccines, or is it investment, or is investment urgently needed in local production? Then she goes on to say, when do you expect the local production to make an impact? She had 3 questions, but I'll give you those 2 for now.
So what is urgent, and I've said this before, is the need, and I'll add the urgent need for countries that are sitting on excess doses of vaccines to redistribute those vaccines so that we can put vaccines in the arm of our people for the collective interest of humanity, not just Africa, but humanity as a whole. If we delay the process of vaccination, then we will not win the battle against COVID-19. That is very clear. Alongside that, we need to begin to build in parallel local vaccine manufacturing on the continent because we know that targets are huge. This is the first time the continent will be striving to vaccinate so many million of people in a very short time. Second thing, the reason we need to work on local or regional manufacturing is clearly that we just don't know the duration of immunity of the vaccines we are dealing with. In other words, we don't know if they will all require, everyone who has been immunized will need a booster immunization. And if that is the case, then it means the vaccination will continue to occur on almost a routine or yearly basis to maintain the level of immunity. And because of that, we can not rely entirely on facilities outside of the continent. We need to rely on our own regional capacity and capabilities. And that is the basis of why, if you recall, we organized a vaccine summit on the 12th and 13th of April this year, which was very, very successfully attended by over 40,000 people in 2 days. So I think a short answer to your question is we need those countries that are sitting on excess vaccines to redistribute quickly. We need those countries that have pledged that they will redistribute excess vaccines to do that quickly as well. But clearly do that in a coordinated fashion so that we collectively as a continent move to achieve a 60%, at least 60% threshold that our continental strategy has established.
Thank you. The next question is also about South Africa, and it's coming from Andrew Meldrum. And he says, is South Africa starting to see a third surge?
We look at the data yesterday carefully with Professors Slim, Karim, and others, and the answer is yes. We are beginning to see a slight urge creeping up of the infections. So that points to the fact that we may and just may be edging towards the third wave in South Africa and other countries. If you look at it, the statistics from neighboring countries as well.
Adis Getachew, who is the correspondent for Anadolu Agency, says that with less than 2% of the population in Africa having been vaccinated, how can the continent expect to meet the planned target of 60% that will be considered the minimum towards population immunity?
Yeah, you're absolutely right. We are not winning the battle against COVID vaccination in Africa, clearly so. I mean, with the rate of this immunization, we are lagging behind. And I think that is why I continue to appeal to the friends, facilitate the demand creation. I think those are factors, those two elements will need to come together to accelerate uptake of the vaccines in South Africa. So again, the formula we've expressed at Africa CDC is clear: vaccines plus vaccination equals life safe. So we have to look at the vaccine as a product, but vaccination, which has several elements. And South Africa has developed a public-private sector partnership that will also bring in the private sector to help in scaling up vaccine. So I think each country will need to innovate itself in that space of vaccine uptake in the vaccination pillar. I mean, when I was in Rwanda 2 weeks ago, it was a question of bringing in the whole of government, where the military came in, helped with the distribution of the vaccines to remote areas and areas of need. And so every country will need to come out with some innovative approaches to facilitate the uptake of vaccines once they are there.
Thank you very much, Della Russell.
Maybe I should just add, when that my appeal to all our member states is that be shuffle ready, so that when vaccines arrive, you use them quickly, because this virus is, we are not winning the battle against this virus, as we keep seeing, for example, South Africa go through the first wave and the second wave and the third wave, and each wave is often more severe than the previous wave. So we are not winning the battle against this virus. So it requires that every member state has to have a shuffle-ready plan so that when vaccines come in, they immediately use them to immunize our population. Each time you put that needle in the arm of any individual, you're saving lives.
Thank you very much. Let's go to Della Russell, who's writing from the Daily Graphic in Ghana. And she says, I came across information that suggested that of the 1.2 billion doses of COVID-19 vaccines that have been administered globally, only 3.7% have been administered in Africa. And there is a projection that the percentage may drop even further in the next 14 days as stocks from COVAX remain unsecured. So the question then is, how will this impact on the continent's post-pandemic recovery?
It's a very good question, Dela. As I indicated, as a continent, we have now secured about 43 million doses of vaccines. So if you put that, you do the maths with respect to the 1.3 billion doses in the world, it can give you the right proportion. Any delay in our vaccination is going to cost us not just lives, but our economies. I mean, because if you take the case of South Africa, if the projection or the trends we are seeing are maintained, then South Africa would naturally go through a third wave, and that will require other drastic measures that will restrict the movement of people, restrict the tourist industry, will restrict so many things in economic development. So that continues to impact our economy and, of course, life safe. vaccines are the most potent tool for our economic recovery, period. I don't know how else to put it there. I mean, if we want to recover our economies, we have to invest in vaccines, and at scale and at speed. I've always said there are three things we need to do on a continent to come out of this. One is fairness in vaccine distribution. Second is the speed of vaccination, and third is the scale of vaccination. We have to do all three things, and that, of course, becomes a serious economic imperative for us to do and do it quickly.
All right, let's now say hello to Rhoda Odhiambo, who is coming to us live. Rhoda, I believe you are with the BBC. Please go ahead with your question.
Hi, Wayne. Thank you so much for taking my question. Yes, I'm with the BBC. I'd like to ask Dr. Nkegasong. So many African countries are redistributing vaccines to other countries that seem to have a good uptake. And this is because countries are struggling to vaccinate people because of widespread misinformation and other people being skeptical and others are hesitant. So what help can Africa CDC